going to introduce our panelists. Let's start with Michael DeStere in that corner, and tell us a little bit about yourself and your practice and your special interest.
Okay. Hi, everyone. My name is Michael DeStere. I am an LICSW. That's a licensed independent clinical social worker. So I think I'm the only one up here who's not officially a CSAT. I'll let them explain what that is. So my background is faith-based counseling, primarily working with Catholics. But generally, I will see individuals for general stuff, but because of the faith component, wind up seeing a lot of particularly young men who struggle with pornography. And so I've kind of worked on integrating some of the faith that they're coming from and the practices of their faith with some of the research and the science behind pornography addiction. So I kind of serve as kind of an in-between, trying to help them integrate those two components in their life. My wife and I have 4 kids. We've been in Spokane for just over 2 years now. Prior to that, lived in Denver for 5 years. And before that was from Montana, which is where I did most of my schooling. So that's it.
Hi, my name is Jamie Korselman, and I am a licensed mental health counselor, and then also CSAT, which is what Michael was explaining. So that's a certified sex addiction therapist, which is kind of under the institution of Stephanie Carnes, ITAP. So it's a training program that deals specifically with sexual addiction. And I've been a CSAT for, 12 years, I think it is, something like that. So I went to grad school in Seattle and was in private practice for about 7 years there. And then my wife and I moved to New Zealand, where I taught. So kind of have a little bit of that background as well. So I taught and had a small private practice there. And then we moved back to Spokane in 2015. So I've been here about 4 years, I guess. And I'm probably a little more generalized, although I still work in sexual addiction quite a bit. And I see couples, adults, men and women both. So that's kind of my practice.
My name is Dave Perry. I'm the executive director for Lifestar Eastern Washington, and we're unlike some of the guys. I think you guys do exclusively, don't you? But this is all I do, is work with pornography and sex addiction. When I encounter other things outside of that, I refer it out. So I have a very narrow focus in my practice. I work with other therapists in the Spokane area, Tri-Cities, that provide the same services. They're on their own. Have their own practices, and the beauty of that is that they have a wide range of skill sets with EFT, EMDR, and many other treatment modalities. So we've been here 6.5 or about almost 6 years now. Prior to that, my practice was in Western Washington and Bellevue. So we're kind of digging Spokane. It's kind of a great place to be. And other than that, that's married, 5 kids, and 13 grandchildren. How's that?
Hi, my name is Mike Unruh, and I'll let Ashley, my wife, introduce herself in just a little bit. We work in 2 locations. We have a practice in Coeur d'Alene called Journey Counseling, and I work here with Spokane Christian Counseling. We have 2 locations in Spokane, Spokane Valley, and Spokane proper. My practice is 100% working with sex addiction, porn addiction. I work with adolescents, adult men, and Ashley and I work with in a healing journey with couples.
I don't have a lot to add to that, but we have been in practice for 19 years now, and CSAT training and got our CSAT certification, been doing that for about 7 years. So that has been primarily our practice. Also do some work with trauma, and I also do work with trauma and depression, anxiety, and things like that as well. I work primarily with partners of sex addicts.
Great, wonderful. What is the youngest stage of a client with a porn addiction that you or others have treated?
I think the youngest, 13, that came to me with about a year's exposure to extreme porn and has continued to see me for the last 2 years.
My youngest is 12, currently working with.
Yeah, I think the youngest I've seen is 14. So
Yeah, I'm trying to think. The last one I can recall, the youngest would be probably a senior in high school.
And this is a 60-year-old spouse of a recovering sex addict. In the rebooting step related to abstinence, does this include marital sex?
It can. In our practice, we are very respectful of people and their relationship. We don't try to dictate any period of abstinence. We talk with the couple about the benefits of that and ask them to examine their own sexual relationship and look at, do you think it's healthy? Do you think it would be beneficial to take a period of time where you would choose to abstain and examine other forms of intimacy? That's usually what the issue is there is a deficit in the ability to have real intimacy, and sexual intimacy has been equated to real intimacy, and it's almost exclusively been that, instead of looking at all the many ways that intimacy can be developed. And so we encourage a period of abstinence. And when people say, well, how long should it be? Again, we don't dictate that. We ask people to consider a period of time. You name the time, and let's have some points of evaluation along the way and see how things are going. So that's kind of how we handle that.
One thing I would add to that is, we focus so much on the addict's sexuality and what's going on with them. And oftentimes people neglect to look at what's going on for the partner with their sexuality. And for partners going through this process, their sexuality can be, wounded by this whole experience as part of that betrayal trauma. So like, for example, a partner finding out that, I'll just give you some examples of couples that I've worked with that, like a couple I worked with where she found out that he had been performing a lot of oral sex on prostitutes. And that was something that they had always enjoyed as a couple. And then she feels like, now I don't want to go there with you. And, so there's a lot of, or finds out that the addict's always looking at, this specific type of porn, and she doesn't match that kind of porn. So it's very confusing for partners when they start to learn what the addict's been doing, and that can impact and create a lot of confusing feelings for partners. And they learn about the addict's sexual health plan and all of this. And so we try and take a very respectful approach to the partner of, what's going on with you and what are your needs and what does healthy sexuality look like for you as a couple as we kind of look at sexual reintegration after this trauma. And so it's really important to think about what's going on for the partner. And it's, after, having their whole world blown up, sometimes partners aren't ready to be sexual with the addict again right away. So there's a healing journey that partners need to go on. You can also have partners that are really afraid to let that the sexual connection go for 90 days if we recommend 90 days, because that's a way that they might have some fears around that. Like, well, maybe the addict will act out with somebody else because I'm not, being sexual with them, or, so it's important to kind of take that apart and find out what's going on for the partner and for the couple, and have really open dialogue around that and support the partner with her fears around it, and also look at what the goals are for the couple.
Very good, thank you. This is a university student who asks, what are the resources for students or those without insurance coverage?
So there's a few different ones, I guess, depending on one component could be if you have a faith tradition, you would want to look at what does your faith tradition offer. So from a Catholic standpoint, there's a lot of being developed. just starting even with the websites. The Porn Effect, there's a new one coming out called Strive, which is a 21-day program. When you're going into more structured, ongoing support, 12-step programs, SA is a sex addiction recovery program, which doesn't cost anything to go to. And then I think from that, you could just kind of, I would say, just starting to see if you have therapists on campus, what would they suggest? Do they have any background in it? They're generally covered as part of your schooling. I don't know if anybody would have.
I would add too, there's a lot of interesting online forums and apps for young people that are free. So things like Clay's program, Fortify, Reboot Nation. There's the NoFap group on Reddit. So there's a big group of individuals that are, trying to get recovery online. There's also the resource Your Brain on Porn, which is very popular among young people. It's a website, yourbrainonporn.com. So there could, and there's some other recovery apps too that are very popular. So I'm not sure if I can think of any other ones right off the tip of my tongue. But there could be some digital support there too. And of course, there's therapists that you can seek out too. One way to find a list of therapists is if you go to sexhelp.com, you can type in your zip code and find therapists that have training in your area. So that could be another resource to look for a therapist.
Can you repeat that?
Sexhelp.com.
Sexhelp.com.
Mm-hmm.
There's also, Michael mentioned SA, but there's also two other S groups that you could always look at. So there's SLAA, which is Sex and Love Addicts Anonymous. And then there's also SAA, which is Sex Addicts Anonymous. And so I think Spokane's got, groups in all three of those. They do differ a little bit, so it's worth kind of knowing. Mainly, at least in my context, I think they differ in how they define sobriety. So SA tends to be a little bit more conservative thinking in that way. So they define sobriety, and sometimes that puts certain people or individuals off. So it's good to know kind of what each 12-step program believes in that way.
And I might mention a lot of churches have 12-step programs that they sponsor on their own. So there's 12-step programs around. There's a new group, SAL, that's beginning out there as well. And another resource to look up for services would be Psychology Today does a pretty good job, but not everybody in sex help is covered in, as mentioned.
Just one more comment as far as the insurance piece too to think about is if you have anxiety or depression, a lot of times that can be covered by your insurance. So you could try to find someone who matches up with the sex addiction piece as well as anxiety or depression, and they might be able to bill your insurance for the one, and then they wind up just fitting in the treatment of the other as part of the whole care.
Very good. It seems like porn and masturbation are almost, quote, accepted and expected with guys, end quote. But as a single woman in my 30s, I've been struggling with porn and masturbation. How do I even begin to talk about this or share it with a therapist? There is so much shame.
Yeah, I can tackle that. So it is much more common for women than people think it is. 2017 was called the year for porn for women because rates doubled almost in terms of women's porn utilization, went from 17% to 30% in 2017. So we have a lot more women. We get porn addicts regularly in our treatment program that are women. So I think it's really to think of it as a men's problem is just not accurate anymore. And so we need to start destigmatizing this for women, because it's now we're getting a lot more people coming forward and talking openly about this, and we need more acknowledgement that this is a women's issue as well. But just like for men, there are, treatment and recovery is possible for women as well. And many of the things that we've been talking about today, like, healthy device management, managing triggers and cues, getting support around it are, very important for women in their recovery process. So my recommendation would also be to reach out for support. You're not alone, and recovery is possible.
Thank you. It's encouraging to see that we have such fine therapists right here in Spokane. And the reason to actually have the panel is that you could meet them and realize that you don't have to travel all the way to Phoenix to meet Dr. Carnes, that we have professionals here. Ashley, you've been named in this question, so you'll go first. What resources are there for spouses to parallel the therapy journey?
There's a lot of resources. It is really hard to narrow down, what are the good resources. There's a lot of good resources out there. I tend to use a lot of Stephanie Carnes material. Facing Heartbreak is kind of a companion to Facing a Shadow. Those are two primary sources that we use in our practice. Mending a Shattered Heart is another one. Vicki Tidwell Palmer also has some great material. She has a great resources on her website that is also by her name, VickiTidwellPalmer.com, I believe. She has a book called Moving Beyond Betrayal. I use that a lot for spouses. Barbara Steffens is another author. She has some great material out there. There's some really raw, hard material, a book called House Interrupted that really kind of puts stuff out there in a way that's like, it's really raw. There are just so many resources, but those are some of the primary ones that I utilize.
A couple. Sherry Keffer has a good book called Intimate Deception, I think it's called. Kevin Skinner has a new book on trauma, betrayal trauma for partners that's really good. There's also a website called Bloom that's really popular for women. It has online forums. Oh, yeah, POSA. Partners of Sex Addicts Resource, POSARC.com, I think. If it's not .com, it's .org. I always try both. But anyway, that's another one that has a lot of resources listed. And they have some support groups as well that are online. There's quite a few, I think, listed on that website. Just one thing I would add for partners is there are 12-step programs that are kind of the counterparts for partners. However, I would recommend meeting with your therapist first and asking them what they recommend. Sometimes, partners, they can be very, due to the betrayal trauma, very dysregulated. And so sometimes those groups can be really positive, and sometimes they can be destabilizing for partners. So it kind of depends on, what's going on in that group. And so your local therapist might know which groups are good and when to refer into those groups. And sometimes for partners that are just learning about this, I kind of prefer to keep them in therapist facilitated support groups. But support groups are wonderful for partners because then they don't feel like they're so alone. So, getting in with a therapist that has groups is wonderful and can be a great resource.
Here's a question from the clergy. Is masturbation ever normal and a part of adolescent development when it is not a compulsive behavior or connected to porn? In other words, masturbation, is it part of adolescent development when it is not compulsive or connected to porn?
I don't know that I'm the best one to answer this question, but I'll try. And I would actually have to go back and double check my source on this. But in my understanding, at least of the chemical effects of masturbation or of climax, there's oxytocin release, which is a bonding hormone, right? And so the way this was presented to me was that to have that bonding hormone released and for there to be no one there to bond with can increase depression, right? So that would be the one thing that I would maybe contribute to that, is it can be depressive from the fact that you're supposed to be bonding with someone when that oxytocin is released and there's no one to bond with.
I think that, so this is a little bit of a tricky question here because I'm mindful of the faith-based environment here. So I would say that, it's important for people to be congruent with where their values are with their faith system. And when people land outside of that, that can be psychologically crippling for people, and they can have a lot of guilt and shame around that. So for somebody that is struggling with masturbation and it's not part of their faith, that can be discouraging and create some distress for people. But there are many people that don't have that faith-based perspective, and for those individuals, masturbation can be healthy and actually have some health benefits. And so I think that there can be healthy masturbation for many people if it's not something that they're wrestling with because of their personal values and beliefs.
I would add to that, if I was just going to answer that question, is it normal? First of all, I would say normal is it normal to watch porn? Well, kind of is in this culture, and yet it wouldn't necessarily be healthy. Is it a normal part of adolescent development? I think it is a natural part of development to explore the body and to wonder what that sensation is or what that feeling is, and to eventually discover that you can have a climax and that feels really good. And so I think that that's very natural, and I think that it is often true that kids get shamed when they experience that. If they get caught doing that when they're young, there can be a shame component added to their distress, where maybe it was just a natural exploration, and somebody comes along, don't do that, and it can be very harsh, and then that can add shame. But then it also there's also this natural curiosity that is present. And so when you wed the shame with the curiosity, with the sexuality, you've got a little bit of a perfect storm. And so you want to just have conversations with your kids as they develop and let them know that that's a thing and that they're not freaks, and that is something that is natural for them to explore. And then, like Stephanie said, within your value system, how do you want to handle that? And even bringing up that oxytocin release and how there are some potential dangers there, and just learning how to have conversations, those awkward, oh, dad, oh, mom conversations. Like, it's important for you to get comfortable talking about sexuality in your family. And if you didn't have that growing up, most of us didn't, learning how to do that is difficult and challenging. And somehow there's always awkwardness to it. And I would say jump into the awkwardness.
Well, this is a tricky area for a lot of people, where to draw that line. In my practice, working with adolescents, when do you cross the line between curiosity and what naturally happens, and when does it become a way for me to change how I feel? Right. So if I don't do well at school or relationally, something's going on. So if they cross that line into using that to medicate how their emotions, then we're getting into a tricky area that is not healthy, that is not normal. So my practice is full of people who have faith-based orientations, but I also have a lot of people that have no religious faith, where the spouse is saying, now this is going to older clientele, that my husband looking at porn feels like betrayal to me. It feels like infidelity to me, which he doesn't get, because a lot of times they're kind of empathy, blank. But it feels like betrayal to that spouse, and there's no faith-based component. So I was very happy to see the Gottman statement come out from them about the importance of that. But I try to work with my adolescent clients, which I have a lot. Most come from a faith-based orientation that, yes, masturbation is going to happen, porn is going to happen, but using that to numb, to medicate is not a part of healthy sexuality, and that's how I approach it in my practice.
Can you expand on the statement?
The Gottman statement.
There was a statement that came out.
Oh, absolutely. It was refreshing to see Gottman make a statement that porn is damaging to relationships. There's just no question in my practice is the impact of pornography use on a man's ability to connect with his wife in an empathetic way. He's running from vulnerability and he's medicating it, so how can he connect?
Yeah, just to add to that, I think I've done a couple of presentations with parents and how to talk to your kids, or even with kids, about sex. And I think a lot of times we ask the wrong question, which is based on morality, which I was happy to actually hear Dr. Hilton kind of talk about. We need to separate the morality part of this, because the question being asked a lot of times is it right or is it wrong? And I don't find a lot of use for that question, actually, in some ways. I think a better question for me is, what does it do relationally for you? Because I come from a faith tradition too, but it's based on a relationship, not on just morality. And so when I ask that question, like, with teenagers, how far can I go with my girlfriend? Well, that question to me isn't as useful as, how do you honor yourself, your girlfriend, your relationship with God, if you have one? That feels like a much richer conversation than, is this right or is it wrong? And so I kind of look at masturbation the same way in some ways. Is it helping your marriage to masturbate? I don't have to actually go to my spouse and say, would you like to have sex? And hear a no, or hear something that's not right, so I'm going to go over here and masturbate and kind of take care of my need. Well, that to me is it's not a relational healthy decision, because we're not actually experiencing a relationship. But that may not always be the case. And so I think that's where I kind of go in that, especially with that particular topic.
Are you familiar with Pure Desire Ministries for men and women addicts as well as partners? Thoughts on their program? Pure Desire Ministries.
I'm pretty familiar with Pure Desire Ministries. I worked locally to coordinate, get referrals from Pure Desire, and worked to support their program. I think it's a great program. The originator went through CSAT training, so he understands kind of the science behind it. I think the primary purpose is to reduce shame. And I think in doing that it does an amazing job, because it connects men that are going through the program. It's a video-based series that translates into small groups. And when men commit to that for that 10, 11-month time frame, it opens up a world to them, a rich relational world that many men have not experienced, a place where they can be known, a place where they can admit things that they've never talked about. So I think it's a great program. I think there are men in that program who are getting better. I think sometimes men are in programs hiding and kind of getting by still. So I think it's a great program.
Yeah, I know Ted Roberts, who's the founder of that program, and he's a CSAT as well. And he seems to have, good materials and runs a from what I've heard, pretty good program.
I've had many partners that I have worked with join a Pure Desire support group. and many that have been very much helped. It was a lifesaver for many of them. I have seen some damage occur. It's not any different from any other group in that way. I think it's important to note that it is facilitated by often people who are also in recovery, and they're lay people. They're not therapists, so it's not a therapist facilitated kind of support group. And I think sometimes leaders in those groups can get sidetracked a bit and not know when maybe they should refer somebody out and make sure that they're getting some professional help. Sometimes that can happen. But for the most part, we have seen very, very positive results from people who have joined those groups.
As a university student, how do I tell my parents about my porn addiction? And what would disclosure look like with them? I have a good relationship with them and don't want to ruin that.
In my experience, disclosure with parents or with adult children or with siblings, other types of family members, we usually recommend that you keep the information pretty general. It's kind of, a lot of times you don't want to tell your parents detailed information about your sexuality. I mean, that's a little weird. So usually speaking in generalities, like I've struggled with porn addiction, and you can share a little bit about what that's looked like for you. As a result, I've had these kind of consequences with school or consequences with relationships, what that's meant for you. And in my experience, parents are, like in 97, 98% of cases, extremely supportive of children that come to them with this kind of issue. And so it's an opportunity for you to get support from your family on something that is difficult, and you might not have a lot of support. And so you might find you get people in your corner that can help you access treatment, and there's so many great programs, like intensive programs you can go to for a week. Maybe your parents could support you in something like that. So I oftentimes encourage when you have a good relationship with your family members to go ahead and be open. It could deepen your level of your honesty in your relationship.
Yeah, and I would just add to that. I mean, I think the point of you having a good relationship with your parents is key there. I don't think I've ever worked with a college student when they've told their parents that their parents haven't been overwhelmingly supportive and oftentimes paid for the counseling so that they can get the help they need. If you happen to be someone whose parents aren't supportive, or you've had kind of a tense relationship in the past, it might look different, and you might look at having something like that, Culture Reframed, that kind of had those scripts that maybe you want to share something like that with your parents in advance to kind of cue them on, this is how to respond, when I share with you something really important, right?
I would say that if you don't have supportive parents, if you do take that brave step and tell your parents and you don't get the support that you need, not to not give up, and to realize that you just never know. I mean, you could have one or another parent who deals with the issue themselves, and you've brought up some shame, and there's an exposure there that is just maybe too difficult for them to face, or they just had no idea and don't know how to support you and are at a loss. But if you have that issue and you don't get the support from them that you need, do not give up, and you will find people who are supportive.
There have been several questions regarding what accountability program or screening program, and someone here asked, please mention Covenant Eyes. Do you recommend Covenant Eyes, or are there other screening or accountability programs that you find useful?
I know Covenant Eyes is a pretty successful one with a lot of people that use it. I won't say it's foolproof. I do know a lot of guys they can push boundaries with any of the blockers. So a filter is not a foolproof solution, right? It's meant to be preventative, I think, in a lot of ways. But once someone's kind of proactively looking for the stuff, there's a lot of ways to get around it. In addition to Covenant Eyes, there's K9, which is another one. I'm drawing a blank. I know there's quite a few other ones out there, but
A router-based Pandora's Hope. For cell phones, I have a lot of my clients use MobiSip, MOBICIP. But I think Covenant Eyes, I haven't, and Stephanie, maybe you know a lot more about it, but I know that they're changing, instead of being URL driven, as far as the accountability, they're going to actually what's being viewed on the screen, which is a cool dynamic.
We invited Patrick Foley. Dead battery. Yeah. We invited Patrick Foley from Covenant Eyes to be here, and he or to show a promotional video, and they're in the middle of changing their entire platform to go from web-based to content-based. So, and they're in the middle of that. They thought it'd be done around March.
there's also, if you look at the routers, I think this is the correct term, Circle is one that's used as kind of parents can moderate how much time is spent on the internet and stuff. And it also has some of those filtering capabilities to block porn from your home.
And I'll just add one thing, not directly like what other programs. The one thing to keep in mind is that sometimes for some clients, actually having the program is really stimulating to them. So you really need to figure out, is this going to be helpful for them? For some people, it's a challenge. And it's more, the challenge is really stimulating to their brain. So even having accountability software or router things, for some people, it's not particularly helpful.
And Apple, as many of you know now, I think it's what that began with the ISO 12, their operating system. The parental controls are much more powerful than they've been in the past. And just as a side note on this, I mean, I encourage my clients, whether they're adult or adolescents, to have device-free bedrooms, device-free bathrooms, and charge their devices in the public part of the house so that you don't have devices where they really don't need to be.
Well, and I would say even some easy things like if you're part of Xfinity or Comcast, they even have some really good limiters on when the internet is open. For example, you can shut the internet down at 10 p.m. or certain devices, you can control all their devices, and it's as easy as downloading an app. And so, you know, any device that connects to my home Wi-Fi, I can control and essentially shut it off if I don't want it there. So.
And one last thing, even if you can eliminate every possible place, which is impossible, anybody who has struggled with pornography or sexual fantasy, you can't get rid of their brain. And so I'm all for identifying where the access points are, but you can't get rid of all access points.
Very good. I just froze, but I know what the question was. I'm in my mid-20s and have had multiple failures, and I'm almost giving up hope. What do you suggest?
I'd say get more support.
Yeah.
Bottom line.
Yeah, you got to up whatever you're trying isn't enough, and some people just need more. So, you know, anytime we have somebody that's constantly relapsing, then you might want to look at a higher intensity of treatment, maybe even inpatient if you really are struggling, or doing an intensive or being in an intensive outpatient where you're actually getting more support than what you've been doing.
I use that same kind of idea or concept, since I'm kind of an initial gateway a lot of times for individuals dealing with pornography. We'll start with developing the counseling relationship, and oftentimes just having someone else walk with you means a lot, right? But it's not the ultimate solution. So onboarding some sort of group, program, and seeing how that works. So a lot of the 12-step programs will recommend 90 meetings in 90 days. So you're talking about developing a recovery program that you're proactively doing every single day for a certain period of time. I tag on with that. Are you spending 90 minutes a day working on your recovery? So if you're going to do 90 meetings in 90 days, do 90 minutes a day and see what that's like, right? If you're still struggling after doing something like that, it shows it's pretty serious and you probably need more inpatient, hands-on care for a longer period of time.
Well, and what is failure? You know, one thing that young people and even adults struggle with, what is progress and what is failure? I had a client years ago that came in and it was all down and very upset. And I said, what's going on? We did our check-in together. And he said, well, I had a porn and masturbation slip. And I said, well, okay. So we processed that, tried to understand the triggers and what was happened for him. But then I looked at his chart and I'm sitting there looking and I said, okay, so that's been 6 months. I said, when's the last time that you've done 6 months? And he paused and he looked at me and he said, never. And I said, okay. I said, how about being compassionate with yourself? You had one slip in 6 months. That's a win. That's progress. I mean, it hurts. It happened. We'll process it. But let's build on that and keep going. You know, to try to restore hope is a key element of what we try to do.
Sometimes I think for me as a therapist working in this area too, you can get focused on sobriety. And sobriety is really important for me, but I think I also need to take in mind this is a relational disorder, this is an intimacy disorder. And so I often kind of think a bigger picture in that way too, of sobriety is an important piece of that for sure, but also what does this look like to develop relationships and intimacy, and so even things like accountability. Is it important to have somebody that you're telling about your sexual behavior if that's problematic? For sure. But it's also important to have somebody that you're telling your emotional state to, or the fight that maybe you had with your partner before this even happened, or the anger you're having. Those kinds of things I think are as important in kind of an accountability way, that we're developing those intimate relationships that, hey, I know I can go to this person and they know me and I'm known by them. Because to me, that's, in a sense, that's what healthy sexuality is about. It's about being known. It's about being vulnerable and seeing the other person. And so that's what I'm also kind of keeping in mind, that it's not just a sobriety issue. Sobriety is important, but it's bigger than that.
Very good, thank you. I'm a parent with daughters. Sounds very familiar, but I didn't write this one. What tools can I give my daughters to discuss with those they date and consider marrying about their interactions and exposure to porn?
I think just since I work with a lot of young men who are dating, maybe your daughters, that most of them are pretty happy to talk about it and pretty happy to get the support from a girlfriend of fighting and dealing with the addiction. So, you know, if it comes from the girlfriend, I think sometimes that's fine. If you're kind of looking for, well, how do I support my girls if they're in that kind of relationship? You know, I think again, we've kind of come up to this theme of we really have to get more comfortable allowing sexuality to be part of the family conversation, so that a daughter could say something like, well, my boyfriend told me he struggles with pornography. Okay, we want that to be an ongoing conversation. We don't want it to be okay, let's get him help and then not talk about it anymore. You know, that it just has to continue to be open, to let you be kind of the gateway of knowledge, of love and acceptance for them as they're trying to figure that out. That would be my piece.
And I would just add, you know, it's important for all kids, boys, girls, to have that education on healthy sexuality, and so that they are able to have the conversations and to be educated on porn and the risks of porn, so that they can feel comfortable communicating about it, and so that they're able to have intelligent conversations with prospective partners and be able to make meaning out of that. So I think the first step just starts with us, with educating them about healthy sexuality and what that means.
But to specifically answer as a father of 3 daughters, what I taught my girls was to ask the question, have you struggled with pornography? But I also taught them that it's not that they've struggled, it's where are they now and what are they doing? And frankly, I would love for my daughter to marry somebody that's in a healthy, strong recovery, that's been healing from the effects of addiction, because they're going to be more vulnerable, more in touch with who they are as a human being, and have more compassion to give them. So I think my advice to my kids, at least not clinically now, is to ask the question.
And I agree, recovering addicts can make great partners. And so I think we need to get that message out there that, you know, this is something, as I mentioned earlier, that you can heal from, you can recover from. And recovery can be an incredible, powerful force. When people are in recovery, they learn so much about themselves and are so much more aware of, you know, what's going on with them. So they can make wonderful partners.
Thank you. Now, as a friend, how do you communicate that you think your friend would benefit from more intensive recovery?
I think you would benefit from more intensive recovery. Sometimes you just got to put it out there. You know, if you know that your friend is struggling, what have you got to lose? You know, they get mad at you, they get defensive, they get angry. You're being a good friend, making that recommendation, letting them know there's support. It's worth the risk.
One thing I'll kind of present as kind of a mind shift for people sometimes, especially for younger people. Very familiar with going to college, spending, you know, upwards of $60,000 to $120,000 on a career. And I just make the point of this is at least as important as what you're going to do for a living, because this is your intimacy. This is your family you're talking about. So if you're willing to spend that much money on a college education, why wouldn't you spend some fraction of it on recovery, on freedom from pornography? Because it's going to mess with every relationship you ever have if you don't. So I think just to kind of give them that perspective sometimes of, if I've spent that kind of money on a career, maybe this is worth spending money on too.
When I work inpatient, a lot of the patients will have to decide, you know, their healthy boundaries around people and friends in their lives that have been, you know, using friends or sexually acting out friends. And one of the things that happens a lot in addiction is as the addiction progresses, they start to push away their friends that are real friends and the friends that are, you know, have their best interests. And one of the things that I see oftentimes when people really get into recovery, that they make this distinction between, you know, these are the friends that, you know, have always supported me in doing what's right for me. These are the friends that have always been in my court and told me that you know, that they're concerned about me and been honest. And you know, those are the friends that they call their real friends and that matter to them. So while it may be difficult and maybe in their addiction it makes them uncomfortable or might push them away, initially you'll be the one that, when they get into recovery, that they'll say, you know, this was one of the friends that was watching out for me and actually was honest with me and, you know, tried to help me. So, you know, I guess I'd rather be that kind of friend than one that just, you know, turned a blind eye to what was going on.
Thank you. This is a 40-year-old student addict. It has been touched on that control is an issue, but I have to wonder if it isn't more of a core source issue. Isn't violence against a sex partner, straight or gay, in a porn, a control high reinforced by sex? Isn't violence against children just looking for more control because children are physically and mentally helpless? Isn't the addiction itself a battle for control over the choices the person makes? Is there any research that directly targets the issue of control?
I'll take a stab at that one. So there's a lot of I mentioned the arousal template earlier, and that there are people that are aroused by all sorts of different aspects of humanity. Some people like these types of body shapes. Some people like, this cultural background. Some people like this particular sex act. So our arousal template are full of these areas that are really erotic for us. And there is definitely people in which having a sense of power over a vulnerable person is core to the arousal template. And so, that's definitely not, it's a very specific subgroup. I would say that that's not something that the majority of people with sex or porn addiction struggle with, but some people do. And so that one of the things that people have to do when they're seeking recovery is really look at what has turned them on in the past and how how healthy that has been for them, and map out and really tear the pieces of the onion back and say, where does this come from for me? And what's that about? And sometimes you can make direct links of what's on the arousal template with trauma. And so with these clients, you have to go to a very deep level and talk about sometimes things that are uncomfortable, and, call a spade with people who have behavior that is like an abuse of power, calling it predatory behavior, or, you're seeking out vulnerable people, and, really looking at that dynamic so that they can reflect and grow around that issue. So, I wouldn't say that that's a problem for everybody, but that can be one element that can come up for people.
And I'm going to take it from a different direction. I think it depends on what you call research. So spiritual traditions, both East and Western, have talked about this issue of control for centuries, right? And so I think whenever you think of control, think of its opposite: surrender, trust, right? So if you have a certain religious tradition, start looking there. What does it teach about this struggle for control? What am I trying to learn as an opposite for that, if it's something I struggle with? As Dr. Hilton pointed out earlier, addiction is pretty much a rapid onset education. Right? So a huge part of recovery is re-educating oneself. And that's a slower process. Right? It's a lot slower to re-educate. But to tap into your spiritual tradition, and the 12-step programs would show a lot of this in their recovery, is to begin that approach from a much slower pace. But it's still incredibly valuable, even if it's not scientific per se.
Just wanted to add, I think this is also, to me, when I would teach beginning counseling students, I would usually use this story of, I think we're all always doing this dance of, we want to be close enough to people that we feel known and that we feel connected, but we also want to be far enough away that we can control that and hide if it gets too close, right? And so when I think of this, it's like almost broadening. This is a human dilemma. Like, we're constantly trying to monitor our vulnerability and be vulnerable in safe ways. Well, that's not really vulnerability, number one, but we do all of these kind of coping methods, whether it be alcohol or porn or work or success, all these things that kind of, it's a way to control that vulnerability in some ways. And I think it was brought up earlier, gosh, porn or even any kind of sexual behavior that's maybe problematic. Well, it's a great way to not be vulnerable, because in a sense, I'm always in control. I'll tell clients all the time, yeah, that picture is never going to look at you and say no. It's never going to think anything different than you. It's never going to argue with you. And you, when you're finished, you can just click, right? Gosh, that's a lot of control, especially relationally, where you don't have that in a real relationship. And so I think that's something that we all struggle with at some level.
What can be done about shameful sexual fantasies that are a challenge to discuss? what can be said about sexual addictions that are contradictory to how we identify sexually in real life?
I mean, the first thing with that is for sure talking about it with your therapist, if you have a therapist, a trusted person. Anything that is secret holds power. That's really kind of just a simple bottom line. If you have a secret that feels dark to you, it holds power over you. And so the moment you're able to talk about it, typically you will experience shame reduction, no matter what it is. And then you can work on, what do I do about it? And if this doesn't match up with my values, or this doesn't match up with whatever, it's not what I want, or it's not what is right for me, you can start exploring that once you start talking about it. So that is probably the most important first step, is you cannot just stay in your own head about it. You've got, and that's just, I'll never, our mantra is like the opposite of addiction is connection. It's not sobriety. The opposite of addiction is connection. So you've got to connect with another human being about the secrets.
Dr. Dines talked about non-pedophiles watching child pornography. Have you seen this in your practices?
I definitely have. Yeah, I've got a client that'll be sentenced next week that downloaded child pornography, but in his psychosexual exams, he's not a pedophile. He didn't masturbate to it, and he didn't cruise playgrounds or do any of the stereotypical pedophile behavior. It's a young man that's in a downward spiral emotionally, and with multiple morbidities going on, and he got onto the dark web and downloaded a bunch of garbage, and that was amongst it. So it's an anomaly in many cases, but in real time,
I see.
he's gonna go to prison.
Yeah.
Either way, but
We see that pretty regularly. People they get into the peer-to-peer file sharing networks, and they end up downloading child porn that they didn't know was there, and then they get busted because the feds monitor that. And so there are a lot of people that get busted for child porn that didn't even know that it was on their computer. And there's also, sometimes in an escalating porn addiction, it's, the people will view things that aren't part of their arousal template, that aren't something that they would normally gravitate to sexually, but it's the next most novel, intense thing. And sometimes they can escalate to things that they find distasteful or are illegal, and be horrified that they looked at that. And sometimes that's what brings them into treatment. I've had that happen many occasions.
I think the nature of the porn industry has a lot to do with that too, just because it's gravitating towards those more extreme things. I remember watching a documentary of, it was a documentary that interviewed people from the porn industry, and one of the producers of that said, "Well, what's left? We've got to do something that is more novel or more extreme, and the only thing left is violence or is the weirdness factor," right? And so, because everything else has been produced, and we're looking for viewers of something, so we've got to produce something that's different. Well, that access kind of leads people down that path, I think, a lot of times, and I can attest to that too. I had a client that was probably 10 when he downloaded something, and that was the first time he saw pornography, and it was underage. And so that really formed and shaped that arousal template, and he struggled, but I wouldn't say he's a pedophile in any sense of the word. It was just that really formed his arousal template, and he struggled. I saw him when he was in his mid-20s with that.
There's a question here about whether the panelists have cards. I would suggest that in your program, all the panelists are listed, and you can go to their website. I've been to all their websites. They're very informative, and there's a contact area there that you can be contacted, make an appointment. Does anyone else have anything else to add to that? In order, can someone contact you? Just go to your website?
Yeah, the only exception would be, I think we're listed with Spokane Christian Counseling, which is one, that's our Spokane practice. And actually, we primarily practice in Coeur d'Alene, and that's still Spokane Christian Counseling, but that's also Journey Counseling. So either one of those would get you to us.
Okay. Should we finish a few minutes early? Everybody's tired. I want to thank you for staying the entire day. It was a wonderful conference. Thank you.
Can I just add a comment real quickly for everybody who's still here? A lot of this stuff can feel like what we call secondary trauma, going through a lot of this, hearing this heavy content. So just as a therapist, feeling for you guys, recognize maybe to do something very positive for yourselves this evening, whether it's detoxing with someone else, having a conversation, engaging in something beautiful, art, music, or something, just to relax and really kind of leave this for now. Before you take action, though, and I think maybe that's the other piece, is just to take away a real action item. Now just ask maybe one person, is this something you've ever struggled with? And just start that conversation.